talk to me a little bit about your military experience as being a dentist. How was that experience? Were you traveling anywhere, or kind of give me some insight on that?
I didn't really travel anywhere. So when I first graduated dental school, I had to go through basic officer leadership course. So I had to learn how to be a soldier, pretty much. Because normally when people enlist into the army, they go through like boot camp, basic training, things like that. So it's kind of like that, except for officers. So I had to learn like military customs and courtesies, who to salute and how to about face and do all that kind of stuff. We spent some time in the field. I did land navigation and sleeping in tents and different things like the military side of things. So I had to go through 6 week training to pretty much learn how to be a soldier, learn how to wear the uniform. So that's what I did first when I first graduated from dental school, and then after that, I went to my first military duty station, which is where they call wherever you're stationed at. It's called your military duty station. So I was stationed in Georgia, so I had to move to Georgia, and I literally worked in a dental clinic on soldiers. So I would put my military uniform on. I'd come to the clinic, change into scrubs, treat soldiers, put my uniform back on, go home. So that's what I mean. I was a dentist, saving America one tooth at a time.
Yeah, for sure.
You'd be surprised. A lot of people join the military because they don't, have access to medical coverage and dental coverage. So a lot of soldiers that we saw, it was like their first time, ever receiving dental care. So it was like a lot of young guys, 18, 19 with severe dental need that, we had to address. Some people like 18 and 19, we were taking out all of their teeth because they never had any dental care, and it was just that severe. So I got a lot of experience with different areas of dentistry, and we had state of the art equipment, being in the military. So I learned a lot being there.
Yeah, no, definitely. That's interesting because I was going to ask you, I guess, being in the military, what were some of the more common dental problems that you may have seen? So I know you just kind of mentioned those with may not had any coverage coming early in, and definitely taking advantage of that, because it's definitely a good benefit to have for sure. What were like some of the other common things that you would notice that maybe you've been in a private practice, but in the military, I guess you notice that maybe they have tend to see more of these issues here, I guess?
Well, since it is the military and I am an officer, a lot of the soldiers that I saw, I outranked them. So when they would sit in your chair and they would just be so rigid, because in their mind it's like, Captain Garrison-Jeter, this is Captain Garrison-Jeter, I'm in the chair, so I gotta, be very rigid. And
Yeah.
so that's one thing that was different. Like, they wouldn't, sometimes if they were experiencing pain or discomfort, they were less likely to say, hey ma'am, something's bothering me, because they're soldiers and they're just, used to being that way. So I had to be more cognitive of reading my patient's eyes or reading my patient's hands. Like, some people, like if something was hurting them, they would, clench their fist a little bit. And then I'm like, hey, what's going on? So I had to be more aware of my patient while I'm treating them, because they may not have conveyed to me that something is hurting them or something is bothering them, because they feel like they probably couldn't say it because I'm Captain Garrison-Jeter, things like that. So that was one thing. I treated a lot of basic trainees where I was, but the particular clinic that I was in, we treated a lot of basic trainees, meaning they were just fresh into the Army. So I did lots of extractions, lots of, fillings and things like that to kind of clean them up and get them soldier ready. So our whole goal of having dentistry in the military is making sure that the soldiers are able to deploy. Because if you deploy and you've got a dental issue, nothing is worse than tooth pain. Okay, so
Yeah,
if a soldier has tooth pain, they can't be out on the front lines. They can't do their job because that tooth pain will take you out. So our job was to make sure that our soldiers were medically and dentally ready to deploy.
Okay, yeah, I was gonna ask you so make sure as long as they don't have any tooth pain, they're good
Yes.
to go.
Or
Yes.
anything that could bother them within 12 months, because, people are gone, 12 to 18 months. So we try to take care of anything that we think could bother them in the next 12 months. We try to get it taken care of.
Okay,
for
yeah,
'em.
no, that's definitely good to know. So I guess during your duration, throughout your time in the military, what were some of your memorable experiences that you had? Maybe not as just a dentist, or just in particular that you could kind of share.
Um, I was in shape. I was
Okay.
fine. I was fine when I was in the military. Because, yes, I was a dentist, but I was also a soldier,
Yeah.
You two jobs, soldier and dentist. So we had, PT in the morning. And, it was to the point where I was working out like probably 2 times a day, because during my lunch break, I change into my PT uniform. I'd go to the gym or I'd go to the track and I'd work out. So I was in shape for sure. That was one cool thing. And also just the camaraderie, like the family. Like it really is like your unit is like a close knit type of family. So that was pretty awesome to see, and to be able to have like it was multiple dentists in the clinic. So to be able to like feed off people and ask questions, because that was my first job, being a true dentist outside of dental school. So it was cool to have, older dentists, mentoring dentists I could, piggyback off of, or show them this case or show them that. So it was cool to have that, somebody to, learn from. And
Yeah, definitely. So being that you said that was kind of your very first experience, would you recommend like that as like a first experience for somebody like, through your program that you went through the military school, and to come out doing like military dentistry at first rather than maybe a private practice dentistry? Which one would be like the, I guess, the harder of the two, or maybe, I don't know, it's probably opinion.
It just depends on the person. It definitely was great for me, because I didn't have to worry about, so a lot of, my classmates were worried about where am I going to get a job at, or am I going to open up a private practice? I didn't have to worry about that. I already knew what my job was going to be. It was already set. I'm going into the military. So it took some of that worry off of me. It allowed me to, because when you first get out of school, you're slow as heck. So if you go out into the, real world of dentistry, it's going to be harder to make money because you're slow. So being in the military allowed me to increase my speed and increase my skill set, so that when I came out into private practice industry, I was ready, because I had the time in, to learn on somebody else's time pretty much, and to get faster on somebody else's time. So it was a great learning experience for me.
Yeah, no, I can see that. Dig that. That's definitely makes sense for me. So I guess moving out of the military, I know you're currently in the Tennessee National Guard as well.
Mm-hmm.
I guess tell me about that. I guess does that just come naturally after, or you just
you can choose that.
Okay.
I chose that. I mean, I did 5 years in active duty, so I just didn't want that 5 years to go to waste. I mean, where else can you retire in 20 years? So when I get ready to retire from the military, I'll be 46, so I'll be able to have that source of retirement that most people can't say that they'll have. So it to me, it just made sense to just continue my service time.